Coming up on Radically Rational, the podcast.
It is called cosmetic surgery, but in many cases, it's anything but superficial.
No, in many cases, cosmetic surgery or restorative surgery saves souls.
As the president would say, that's not hyperbole.
Coming up on Radically Rational, a conversation with one of the leading plastic surgeons on Earth. Hello, and thank you for joining us. Welcome to another edition of Radically Rational, the podcast. At Radically Rational, we're bringing facts back into fashion, and we're making simple sanity sexy again. And if we violate that rule, we get called out by an 8-year-old girl.
Did it take you all day to come up with that?
I had that coming. All right, I'm Paul Alexander. This is my friend and partner, Anthony Pittman.
Hey, Paul, good to see you again.
It's my pleasure for sure. So as we explained in the opening, we're talking about cosmetic surgery, but that does not mean that it's superficial at all. So since this is the subject, the first thing that I would like for our listeners and viewers to do is not hate Anthony and me just because we're beautiful, right? I mean, there are other reasons to hate us.
Exactly. There are many other reasons.
We are really honored. Our guest today is one of the really preeminent plastic surgeons in the country and the world, Dr. Peter Grossman, and I've had a previous conversation with him. This is a wonderful human being who does what he does for all the right reasons. And Dr. Grossman, first of all, welcome, but let's just jump in with this. You know, you hear cosmetic surgery, and you think of it as being kind of superficial or a luxury maybe, or a first world problem. But this addresses some real human concerns. What drew you to this area of medicine?
Well, first of all, Paul, Anthony, thanks so much for having me here. It's my pleasure to be here. To answer your question, one of the things that has made me feel kind of satisfied in my adult career is being able to do something that people, for lack of a better word, value. They feel that I'm helping, and that gift comes back to me. I read a quote once that the gift belongs to the giver. And sometimes if you can do something with your hands or with your actions or with your words that makes somebody else feel better, it really is a reward in itself. And I realized as my education was coming to a change and I was going into my career that I wanted to do something that I could actually physically put my hands on and have an effect on, and do something that made me feel good. And between what I do as a plastic surgeon, taking care of burn injured patients, as well as taking care of patients who are requesting cosmetic surgery, it's made me feel like I have a purpose. And so that's kind of why I went into it. And I really do enjoy doing both aspects of that realm of plastic surgery, burn as well as cosmetic.
I know, Dr. Grossman, we want to get more into that, especially. But when we think about it, what's the biggest misconception, as you see, with cosmetic surgery?
Anthony, I think the biggest misconception is that it's superficial, that it's a vanity issue, that it has no real value to the individual other than to a sense of narcissism. And I think that that's really, really far from the truth. Clearly, there are outliers. There are people who have a need for reasons that maybe not as genuine. But most people, they look in the mirror, they say something doesn't look right to me. I don't feel good about myself, and I want to feel better about myself. And ultimately, what cosmetic surgery does is make someone feel better. And that should not be invalidated. Having a sense of self-confidence, having a sense of positive imagery is something that we all want. And I don't think that any of us can deny that when we look in the mirror, we hope we look okay to ourselves and to others, that we hope we can be physically fit, that we can be mentally fit, that we can be psychologically fit. And to deny the fact that there are aspects of our physical appearance that make us feel uncomfortable or self-conscious would be a fallacy. That's why we go to the gym. That's why we diet. That's why we sometimes will color our hair. There's nothing wrong with that. To invalidate it, I think, is a disservice to most individuals.
I think we've gone so far as to say that it saves souls. Is that an overstatement?
I don't think so. I think that you can find individuals who are rightly or wrongly. I mean, you may say, oh, you should feel good about yourself no matter what. And those are very nice words. But words and reality aren't always the same thing. And there are people who find themselves very withdrawn socially, very self-conscious about certain aspects of their appearance. And when they have this surgery, their whole outlook changes. Their sense of positivity, their sense of self-image, their confidence, lack of depression. Mental health and your appearance sometimes can go hand in hand. Now, don't get me wrong. That doesn't mean that we all have to be beauty queens or have movie star looks. That's not at all what cosmetic surgery is about. What it's about is internally feeling good about yourself. And that's it. It's not to meet somebody else's standards. It's to try to make yourself comfortable internally.
Okay, you have a world of experience. You're definitely not new to this rodeo. You've seen trends over the years. How has social media affected the way we look at cosmetic surgery?
Wow, Anthony, that is the big question. And I think, like every aspect of social media, there are some huge positives and there are some huge negatives. Social media has allowed us globally to learn about each other, to, in a very rapid fashion, transmit knowledge and have people communicate with each other. But by the same token, it has created an unfair sense of judgment, an unfair social pressure, standards that are unrealistic, alterations in images that then get perceived as reality. On social media, you'll find that false information travels much faster than reality, and retracting false information almost never really exists. Sometimes we find that through social media, people try to live to other people's standards, and they will then get judged harshly by their appearance. And this is what's tragic about social media and its effect on cosmetic medicine, that one might feel through social media that you have to have a certain look. Your lips have to look a certain way. Your cheeks have to look a certain way. Your eyebrows have to have a certain slant. Your butt has to have a certain curve to it. That's all BS. You don't have to match anybody else's standards. What cosmetic medicine and cosmetic surgery is about is how can you make yourself feel good, not to try to compare yourself to somebody else.
Well, and of course, the societal problem that you're describing is particularly alarming with young girls. And we've seen that culturally. This has led to some really tragic results. Fold that into this whole circle, if you will, please.
Paul, it's one of the hardest things for myself and my colleagues and anybody in the field of cosmetic medicine to deal with. The pressure on younger individuals and probably more younger females is enormous. And the impetus, because of what you see on social media, to have procedures that are either not necessary or perhaps even detrimental is pretty large. Now, again, in plastic surgery and cosmetic surgery, necessary is a challenging word to use. Mm-hmm. Necessary, in my mind, means it makes that individual feel good about themselves. Necessary is not trying to match somebody else's likes on social media or not match how many other followers somebody has. But unfortunately, the pressure on young individuals now is to get the most amount of likes, the most amount of comments, the most amount of followers. And to do that, sometimes they will do either extremes or follow patterns that may not be what they feel like in their heart or in their soul, but feel that that peer pressure pushes them to do things. And that almost always ends up badly.
Okay, a potential client feels like he or she is needs the plastic surgery, needs the cosmetic surgery. They see it as necessary. Have you ever said to them, no?
Yes. I think every person in plastic surgery needs to learn how to say no. You are doing your patient a disservice by not knowing when to say no. You are doing their family members a disservice, and you're doing yourself a disservice. Sometimes people may ask for things, and you know that you can't achieve that, or you know that in doing so, you will permanently create another problem. The information that's out there, oftentimes transmitted through social media, is relatively incomplete. Someone will post best results. Someone will post, this is how I look. But you can't make a person look the same as another person. You can try to get features that go along with that individual's body, but you can't make them look like somebody else. So when somebody comes and asks me, I want to look like this person, I will tell them, I can't do that. This is what I can do. And if they push, I'm going to say, I'm sorry, that's not what I can do, and we can't move forward. Or if they want to do more than I think is safe at one time. Oftentimes people are influenced by some shows that used to be on these extreme makeover shows, which were very entertaining, but not necessarily the safest ways to go about with surgical procedures. You don't want to have to do a maximum amount of procedures at one time. You want to do it safe. And so sometimes you have to pull back and say, no, we can't do all of this at one time. Or no, I'm not going to put 1,000 cc breast implants in a 5'2" 100-pound woman. There are certain standards where you have to feel you can't violate. And I think the vast majority of my colleagues do that. Unfortunately, what you often will see are those outliers that don't follow those ethical guidelines.
Our guest is Dr. Peter Grossman, one of the truly prominent plastic surgeons in this country and indeed the world. And Dr. Grossman, your practice is split between cosmetic plastic surgery and restorative plastic surgery. And in particular, you have done some wonderful work with burn patients. And I think that resonates with all of us as human beings. I think there's something particularly terrible about that frightens all of us and is really deep in the human psyche. Thank you for doing that. I think we're all very empathetic. That has to have been incredibly rewarding for you.
It's something that makes me feel just proud to participate in, to come to work with a great team of healthcare professionals who all have to work together to try to get somebody in a bad place to a better place. And I've been very fortunate to do that. It's something that's sometimes very emotionally painful, because I think, as you mentioned, Paul, it's something that strikes a chord in all of us, because it can happen to any of us in a split second. Some of us may think, well, I have no family history of cancer, or I have no family history of diabetes, and that's not going to happen to me. But with a burn injury, it takes one moment for your entire world to turn around. Sometimes it's just a small burn, no big deal. But a large burn injury can happen, and it can happen to anybody. It can happen to an infant. It can happen to the elderly. It can happen to men, women, children, adults. And when it does, it not only affects their appearance, but their sense of self and their ability to function. And so our goal is to try to make them feel better physically, functionally, cosmetically, and emotionally. And I say cosmetically because every patient who gets burned wants to look better. Yeah. And that's where I see the joining of my cosmetic practice and my burn practice, because everybody wants to feel comfortable. Nobody wants to feel like they're ostracized because of their appearance. Nobody wants to feel that because of the way they look, they are compromised in society. And So I see a blending of the two of what I do. And I do feel that I perhaps do burns better than I would have if I didn't have a cosmetic background. And I probably know how to handle tissue a little better than I would have if as a cosmetic surgeon because of my burn background.
Dr. Grossman, was there a personal experience or a moment when you decided that you were going to put that heavy concentration on burn victims?
Well, Anthony, nepotism has been very good to me.
Okay.
My father was a plastic surgeon.
Oh, there you go.
And so when I got out of training, I went into practice with my father, and he was a role model to me, and basically did a similar mix of cosmetic medicine and burn surgery. And I saw how people responded to him. And as I mentioned earlier, there's something that's just almost magical about somebody appreciating what you do. And I think that's what, I saw when I observed my father and his patients, even as a young boy. And, that's kind of my motivation right now. And I just want to keep making myself feel good by making others feel good. And I don't want that to sound too corny, but it is kind of, what's a driving force for me. And it was because of the kind of the role modeling I had from my father.
I love the link that you made moments ago between cosmetic surgery and mental health, because that really is the key issue here. I want to ask you about your own life. I'm sure there's an assumption. You're a very prominent plastic surgeon in Los Angeles, home of the stars. A lot of people are going to get this idyllic view of your life. This must be great. This has got to be very tough on you sometimes. Give us some sense of what's a good day for you and what's a less good day for you.
Well, let's divide it into my cosmetic practice and my burn practice. From a professional standpoint, if I can have somebody come back to my office after performing a cosmetic procedure on them, and they have that smile on their face, and they say, "You really made me feel better about myself." And I know now that I have the tools to go on in my life and be happier. And sometimes just that thank you card, a little card that maybe have 2 lines on it, that makes your day. Contrary, sometimes you said, "Oh man, I did everything I could," and somebody's not happy. And that is the problem with cosmetic surgery is learning how to manage expectation. You try to tell people what they can and cannot achieve, but sometimes that mental connection between you and the patient isn't always there. And either I, as a surgeon, didn't explain it well enough, or they, as the patient, didn't hear it well enough. But either way, there is a miss in the expectation. And that's disappointing for me. And then, of course, look, every surgeon has cases where they say to themselves, "Oh, I could have done better." And that's a disappointment, internally. On the burn standpoint, if I can see somebody who my team and I have been able to get through a very difficult situation and leave that hospital and do what I call the victory tour, walk out when, odds weren't always in their favor, that's an enormous positive day for me. But unfortunately, there are times when I see someone who isn't going to do well, and I've got to tell them, or even more painful, tell their parents, especially if it's a child, that things aren't going to go well. And there's nothing more painful than to have to tell a parent or a family member that their loved one either is going to have tremendous lifelong disfigurement or is not going to survive. There's never a time when that's easy. There's never a time that doesn't make me feel that sometimes my job is hard. But that's medicine, and that's the life that all of us who go into have chosen. And so you got to take the good with the bad.
In essence, though, when you run across those situations, is that yet another reason why you continue to do what you do with a certain drive?
I think you always want to do better. I mean, I've been doing this a long time now. I've been in practice over 25 years, and I still want to be better, and I still want to do this better than I've done the day before. So yeah, Anthony, that's absolutely it. Everything that I do, I want to say, okay, what can I do to be better? And I think a lot of my colleagues feel the same way, and that's what keeps us in this game. Medicine's a tricky business these days. It's hard. It's regulated in so many ways. Some of the personal freedoms have been taken away that got us into this field. And there's a lot of people who feel, I don't want to deal with this anymore. But for me, yes, that exists, but the thrill of making somebody happy at the end of the day, that's the hook. That's the addiction.
Dr. Grossman, we've only got a couple of minutes left. And first of all, thank you for working us into your schedule. We're very grateful for that. But real quick, and I realize this is an off-the-wall question, what is the next really exciting breakthrough in plastic surgery? What gets you going? What is out there on the horizon that needs to happen and that you expect to happen?
So that is a very good question, Paul. I've got a podcast that I'm working on called Beauty and the BS. And what that does is separate what works in cosmetic medicine and what is just total BS. And there is a lot on each side. There's a lot of hype in medicine right these days, and people will tout some new technology that really doesn't work very well. Those are the things that I think people should be aware of, and I'm happy to go into that at some point, or have you listen to the podcast. We'll go into that. But there are a lot of positives that are going on right now. I think the whole regenerative medicine field is going to change all of our lives in the next 10 to 15 years. Today, we talk about stem cells, and stem cells right now are really good in the laboratory, but to spend a lot of money on stem cells right now is a little bit premature. And I would caution anybody to go into having therapy with a lot of stem cells, because we don't really know how to direct the stem cells to do the job that we want. And by stem cells, I mean stem cells or cells that can regenerate tissue to be youthful. But on a cellular level, we're going to find that we are going to be able to make our bodies younger again. Plastic surgery has to deal with both engineering and mechanics. Most of what we do as plastic surgeons these days is acting as a mechanic. We pull, we tighten, we shine, we buff. But what we really need is engineering, how to engineer our bodies on a cellular level to make us younger. And now with the exponential speed of computational technology, with the ability to make things in nanotechnology or microtechnology, we'll be able to change things on a cellular level. And without significant cosmetic procedures, we will be able to look younger, but more importantly, physiologically be younger longer, because we don't want to grow old. There's nothing graceful about aging. Aging is disease. Aging is heart disease, Alzheimer's, diabetes. What we want to be able to do is stay younger for as long as possible. And that's what I think is really exciting about cosmetic medicine and regenerative medicine in the future.
Okay, I want to get you with at least one more question. But first, a statement. Beauty and the BS, the podcast. That is a great title.
And plug it, by all means. We're fans of that podcast.
Thank you. Did you notice my less than subtle plug right there?
Absolutely.
I like that. Beauty and the BS. Listen to the podcast. Okay, but number two here. If you're at a dinner party, someone comes up to you and they find out you're a cosmetic surgeon, plastic surgeon, what's the first question they hit you with?
I love it.
It kind of depends on the age group. As I've gotten older, my patients have gotten a little bit older. So I tend to see a lot of people who are, asking about, faces. But I'll get people asking me, what can be done about my eyes? What can be done about my hanging neck? I'll get a lot of people asking me about some of this technology about cool sculpting, which is kind of freezing the fat, or something called sculpture, which is heating the fat up, and can we melt things without working out? And the reality is, I have to tell everybody, if you want to take a shortcut, you're probably going to get a short-term result. There's nothing that really bypasses that right now. Technology is great. It's improving things. We are so much more advanced and so much better than we were 10, 15, 20 years ago. And 5 years from now, because of the speed of advancement, things are going to be better. But be cautious. And so most of the time, they'll ask me about new technology, and I say, it's good, but don't dive into it with both feet. Put your toe in it first before you spend a lot of money on some of the new technology.
I thought the answer was going to be, has this actor had any work done?
You know he gets that.
I know it. You're just being kind, and we don't want to throw names out there, but you know that's the first question someone says. Has this person had any work done?
You caught me, Anthony. I'm trying to be subtle, try not to name names, but yeah, I mean, we all do that. I mean, look, none of us are immune to it, even us in my profession, looking at somebody's picture and go, what would they have done?
Yeah.
Are you proud of us for not asking that question?
Until the very end.
At least until the very end. Dr. Peter Grossman, thank you so much. We are so appreciative of your time. This has been a wonderful conversation, and if we're lucky enough, we would love to do it again.
It would be my pleasure. Thanks, guys. I appreciate you having me on. I look forward to seeing you again soon.
What's the podcast one more time? What is it?
Beauty and the BS with
Yes.
Dr. Peter Grossman, and it's on any place where you get your normal podcast. So we hope you'll tune in and listen to us.
Success with that.
Absolutely.
Great
we
idea.
are all over that.
Thank you.
Well, dang, Pitt. Like I said, I thought we exhibited admirable restraint sometimes.
Held off to the very end once we had the podcast almost done. So
Now, we can do our own shameless plug now, right?
Yes.
Okay, we want you to visit the radicallyrational.com. It's got all kinds of stuff on there. It's got columns by Anthony Pittman. We've got a daily news blog, a daily sports blog, daily videos, the archives of our podcasts. The whole idea here is we want to take the subject matter seriously without ever taking ourselves seriously. We want to have a good time, but we do need to return to a fact-based society. Thank you so much, and we'll see you next time on Radically Rational, the podcast.